Good evening, one and all present here. Panchajanya, the divine conch of Bhagwan Shri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motto in the mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life, all this while working in a path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharata Shastra, and values to all the states of people in every corner of the world. Also, the founders being Ayurveda aspirants, known the inside out of today's medical field, hence they aim to make people aware of this and also try their best to solve this on the go. This is an organization that is created by 28 young energetic individuals of 21st century where all have left behind their differences, insecurities and have come together united for the betterment of this great nation and its heritage. We at Panchajanya recognize each and every individual's true potential and make sure they reach their maximum. Everyone who is part of this family performs on their own will but within the limits of services and contribution. Our main goal is to reach every individual in creating awareness of our ancient knowledge and wisdom, its efficacy in the modern era, and link with the current ongoing affairs, its revival, and most importantly, bringing everyone together in working towards establishing a strong system. In order for all this to be achieved, we have set up various wings with working principles and objectives that help achieve the goal faster and easier in the coming years. These are Ahilyabai Wing, Swami Vivekananda Wing, Karnatabala Wing, Govardhana Wing, Ashwini Wing, Narada Wing, Kautilya Wing, Vedavyasa Wing, Nalanda Wing, and Sanjaya Wing. Coming back to the members involved in our organization, we have doctors, healthcare workers, teachers, students, and peoples from almost every single occupation available aiming at working together and bringing forward the true essence of Bharata and her traditions. So, all those who fit under these categories are welcomed with the honor and privilege. Today, this evening, we have Dr. Ashitha ma'am, who is currently working as an assistant professor in Department of Swastavritta and Diet and Yoga consultant in Munial Institute of Ayurveda Medical Sciences. Ma'am has secured second rank in MD Swastavritta in RGHS exam. Ma'am has certified in maternal and child nutrition from Medversity Apollo Hospital. We are very happy for inviting you to this session, ma'am. Thank you for accepting our invitation. You can carry over the session, ma'am.
Okay, thank you so much for inviting me as to be a part of Panchajanya exam orientation schedule. So I'm very happy that you guys are taking an initiative like this for your seniors. So yes, without any much introductions, we'll straight away dive into the topic. I hope the screen is visible, right?
Yes, ma'am, it's visible.
Okay, fine. So, the topic that is given for me today is Parivara Shishu Kalyana Yojana and Matru Shishu Kalyana Yojana, which is nothing but family planning. The first segment is family planning, and the second segment is mother and child healthcare. So, we'll straight away dive first into family planning, and then we'll talk about maternal and child healthcare. Okay, so as in directly starting with the family planning. So the definition, any preventive and social medicine questions, whenever the paper 2 is asked, the definition of every question is very important, which is provided in according to any references. That would be ideal to write in the answer sheet so that the mark scoring will be very easy. So when it comes to the definition of family planning, as you can see here, it is a way of thinking and living that is voluntarily adopted by the couples or by the individuals according to their responsible decision in order to promote a family welfare. Okay, so a simple definition when we consider a family planning, it is nothing but it is defined as the ability of individuals and couples to anticipate and attain their desired number of children, or it can be spacing, or it can be improving the time in between the births. So a couple may want child now, and after the delivery of the first child a couple may not need another second child for some few years. So there are different methods that they can go for spacing, which we will discuss in the further slides. So either the couple or individual can go for it, one example. Or now after having a child, couple do not want any more child, there are permanent method of family planning which they can again adopt according to their decision. So there are different categories, there are different choices according to the like individual decisions what a couple need. That is what is basically simple definition of what is actually a family planning offering. Now coming to the objectives, I'm not going into every single details, like minute every single details I'm not going, because it's already covered in your classes, in your syllabus. But let's see what all are the highlights of this topic, because both the topics are very vast. Okay, so now moving on to the major objectives of family planning, you can see here. First is the first basic thing is to avoid unwanted birth. That is, a couple do not want a child for some years, they can go for some family planning methods. Or it can be to bring about the wanted births. Again, there are, we will cover about all these things again in the later. Third one is to regulate the intervals between the pregnancy. That is, like say for example a 5 or 6 years after the couple want the next child, okay, till then what all are the methods, what can they do, that is again provided in the family planning. And the rest of the two things are not that very important, but first three objectives are very very important. Okay, so now coming to the next part, who is exactly in need of a family planning? Now this is what is displayed here, that is eligible couples. Now eligible couples are mostly asked for 3 mark question, and it is a repeated question also. So please note that what is eligible couple is nothing but it refers to currently married couple in which the wife is in the reproductive age, which is from the age of 15 to 45 years. So basically these are the eligible people or eligible couples who are for family planning services. Now I said already that there are different methods or there are different techniques that like a couple should be using in order to bring the wanted births or to avoid the unwanted births. Now what all are those methods, or how do a couple achieve this family planning is via contraceptive, or that is what a contraceptive is doing. So you can see here what is basically a contraceptive is, or contraceptive methods are. It is nothing but it is a preventive method to help women avoid unwanted pregnancy. So there are permanent methods, there are temporary methods, whatever the couple needs they can go for it. So basically that is what is a contraceptive is meant as. Okay, now either you can call it as a contraceptive method, or you can also call it as a fertility regulating method. Okay, so far I hope it's clear. Now we are coming to what is exactly a contraceptive should be, or what all are the categories or criteria an ideal contraceptive should be having. So again you can see here, one thing, it has to be safe. That is, whatever, no matter whoever administers it, it should be safe for everybody. Second is it has to be having efficacy. That is, if it is offering it, couple will not become pregnant, the lady will not become pregnant for some years. It has to be having efficacy in this particular number of years. If it's not working, then the contraceptive is actually a failure. Third one is it should be acceptable by everybody. That is, if it is having a very particular complicated method of administering, then the couples may not get motivated to use the contraceptive, which is again a failure. So it has to be acceptable by everybody. And next is inexpensive, reversible. So reversible means nothing but if the contraceptive is administered and after a few years couple wants a child again, if this contraceptive is not allowing the women to become pregnant, then again it's a failure. So that is why whatever contraceptives, ideal contraceptive, it has to be having a reversible effect. That is, when the couple stops using it, they have to be able to conceive. Okay, and next is simple to administer. It should be independent of coitus, and it has to be long lasting. That is, every time, every now and then, the couple should not be in a situation to use it again and again. So it has to be long lasting effect, it has to have a long lasting effect, and it should be requiring no medical supervision. So these are the criteria that an ideal contraceptive should be having. Okay, so now coming to what all are the basic methods that are coming under family planning. You can see here in this flow chart, we have temporary methods as well as we have a permanent method. So in temporary, you can see there are barrier methods, there are intrauterine devices, there are hormonal methods, there is post conceptional methods, and other miscellaneous techniques are there. And when it comes to permanent method, you can see that is there is male sterilization and there is female sterilization. Now let's go into one by one in detail. Okay, so coming to the first thing, that is barrier method. Again, we have physical and chemical barrier method. So when it comes to physical barrier methods, we have male as well as female condom, we have diaphragm as well as vaginal sponges. And when it comes to chemical barrier method, we have foams, creams, suppositories, and soluble films. Okay, now coming to the barrier method. So I think I've displayed this image for you guys to understand. Whenever you are writing examination, you can understand when there is a barrier word itself comes, you can see here there should be a barrier in between. That's why it is called as barrier method. So here you can see we are discussing first regarding physical barrier method. So basically, aim of this barrier method is nothing but to prevent the live sperm meeting the ovum. So that is why it is called as a barrier. A barrier is created from the sperm meeting the ovum. Okay, so that is why it is called as barrier method. And basically, there are advantages for this barrier method. So which first one is, it is not having any side effects which is associated when it comes to pill or other intrauterine devices. And this is the contraceptive benefit. That is basically a contraceptive when it comes to a barrier method. As a contraceptive, what is barrier method offering is nothing but side effects. When it is compared to pill or IUDs, it is not there. Okay, now there are other non-contraceptive benefits for this barrier method, which is a repeated viva question. Okay, so this is something which is usually examiners ask in the viva. What are the non-contraceptive benefits of barrier method? So first thing is this protection from sexually transmitted diseases. Okay, first one is that, and second one is reducing the incidence of pelvic inflammatory disease as well as reducing the risk of cervical cancer. So this is the non-contraceptive advantages of barrier method. Okay, so as in the example of barrier method is nothing but male as well as female condom. So I think usually when it is in practical exam, I hope you might have already done 2 or 3 practical examination. This is one specimen usually they will be keeping in most of the colleges. So basically, male condoms is widely known as Nirod in Indian market. And again, as I said already, it not only prevents the pregnancy, but also it helps in preventing the sexually transmitted diseases. Okay, so condoms, male condoms or condoms is a usually 3-mark question that is asked in the examination. You can go through the previous question paper. I think majority of the time condoms is a 3-mark question which is asked actually. So note down, please note down whenever condoms is asked, you can write. And you can go for the method of administer also, which I haven't included in the slides as in because we have lack of time here. Okay, so this is regarding the male condom. There is a method of administration also which is mentioned in the textbook. You can go through it. Now coming to the mode of action here, condom basically prevents the semen which is to be deposited in the vagina. And if it the efficacy of this condom will be more more if it is administered along with a spermicidal jelly which is inserted into the vagina. So if at all there is a tear of the condom or condom failure, contraceptive failure, then this spermicidal jelly will be the one which is helping for the women not to conceive. Okay, so this is regarding the mode of action. And when it comes to advantage, they are easily available in the market. It is again safe and inexpensive. It's not again requiring any medical supervision, nor it's having any side effects. Again, it prevents STD. So these are the basic most important advantages when it comes to the condoms. So not only male condoms are there in the market, we also have female condoms. Basically they are otherwise known as internal condoms. Okay, so I've put up a picture over here so that you can understand how is the administering. So you, again, it's a pouch which is made of polyurethane, which is lining in the vagina. Like when it is inserted, it will line the vagina. So this, there is an internal ring as well as there is an external ring. So it is being inserted into the vagina so that again it prevents the deposition of the semen into the vagina. Okay, so this is what is a condom doing. So this is regarding the physical barrier method, that is first method. Okay, now second method is diaphragm. So diaphragm is also, you can see the image which is displayed over here. It's also known as Dutch cap actually. So you can see here, diaphragm is a vaginal barrier and it is a shallow cup made of synthetic rubber or the plastic material. Again, usually it will be having a particular diameter of 5 to 10 centimeter, and again it's having a rim, that is ring like structure. So if the diaphragm is of proper size, like ideally a woman has to choose the diaphragm which is of proper size. There are different sizes like that. I have not mentioned here because it's not that important for you people. So you can, I mean, women can insert it according to the size of the vaginal muscles. That is, sometimes after the birth it will be relaxed and all those things will be there. So accordingly the women can go for the right size. And then I've displayed over here how it is being administered. You can clearly see how it is inserted. So this is how it will be. This is the another diagram which you can more clearly understand when it is kept, how it will be seen. So you can see here, the sperm will be like even if the sperm is deposited into the vagina, there is no chance that it will be meeting ovum because of the diaphragm which is kept. Okay, so again we are not going into more details here. Now when it comes to the method, so method, you can see here it is inserted before the sexual intercourse and it must be remaining there for not less than 6 hours after the sexual intercourse. Okay, so again here also it is administered with a spermicidal jelly along for an additional protection. Okay, so usually that's the method. So again, risk and medical contraindications are not actually found, but still there is a problem that if the diaphragm is left in the vagina for more than 6 hours or more than an extended period, sometimes there are chances that a toxic shock can happen and further complications can be there. So that is why this is one disadvantage of a this diaphragm. So again, initially sometimes a physician might be required in order to demonstrate. So this is not an acceptable method for everybody, but still okay, in some conditions diaphragm can also be used. Okay, so this is regarding the diaphragm. And third one is third method is vaginal sponge. So again, it is very similar to the structure of diaphragm. Here you can see here, so this is a polyurethane formed sponge, which is again measuring 5 centimeter to 2.5 centimeter. So again, it's applied with a spermicide nonoxynol and it's inserted into the vagina, and thereby it will be preventing the conceiving. Okay, so all these are the methods that is coming under physical barrier method, which is very important. Out of this, condom is very important. Both male and female condoms are commonly asked question for 3 marks, which is very important. So it is only in physical barrier method. Now we are moving on to the chemical barrier method. There is nothing much to explain over here. Basically it is a chemical barrier method, which is clearly understandable that some chemical is being introduced into the barrier method. So basically it contains spermicides. So spermicides, what happens is they attach themselves to the spermatozoa and usually it inhibit the oxygen uptake. So basically sperms will not be live further and they cannot go and conceive the ovum. So that is what is the mode of action that is happening here. Different categories available in chemical barrier method is foams, creams, jellies, suppositories, and soluble films. All these are the different chemical barrier methods that is available in the market. So I've just put up the pictures over here so that when you go through this you can understand it. So this is gel and paste. There are different other tablets, then contraceptive films are there, and other sponge methods are there. All these are coming under the uh, different chemical barrier method. Okay, so with this we are coming to the end of barrier method. So first method which we discussed was barrier method. Now we are going to the intrauterine devices. So you can see again intrauterine device, the name itself is telling that it is intrauterine device, that is devices which are going inside the uterus. Okay, so here there are two broad classifications, that is first is non-medicated iud, otherwise known as inert iud. Okay, or they can also be called as first generation iud. Okay, now, next is medicated IUDs, which consist of second generation IUD as well as third generation IUD. So, these are the three different types of intrauterine device. Now, please note, intrauterine device alone can be asked for 5-mark question. Basically, that is a 5-mark question. Intrauterine devices in whole together, they can ask intrauterine device for 5-mark question. So, please note it down. So now coming to what all are the description of intrauterine device. It is basically made of polyethylene, and it will be medicated. There are medicated types as well as there are non-medicated types. So first generation or non-medicated type is lipase loop. Now it's a double S shaped instrument or small material, which is again made of polyethylene. Okay, so usually it is having a thread which is attached at the end of this double S shape, and it is inserted into the vagina. So there are different sizes of the lipase loop according to the, again as we discussed in the previous barrier methods also, according to the size of the vagina, that is if the person is delivered or not delivered, according to the size of the this thing, they can go for the insertion. Okay, so this is regarding the lipase loop. Now you can see here the images, like I've put the insertion as well as a removal picture so that you clearly understand what is exactly happening when it is coming to the lipase loop. So this is how it looks like, and you can here I've put it in this picture is being inserted just to see how what is the size of the lipase loop, how small it is. You can understand here. So how is the mode of action of the lipase loop is nothing but basically it is non-medicated. So it's understood that there is no any medicine inserted in the lipase loops, that it goes inside the vagina or uterus and it acts as spermicide or anything. There is nothing like that. But here, as it's a non-medicated, what is the mode of action happening here is it is acting as a foreign body. So when this lipase loop is inserted into the uterine cavity, what happens is the body identifies this as a foreign substance, and as a result it attracts the macrophages. Now macrophages will start stimulating, and this macrophages will be acting as a contraceptive in this case. Now usual complications that can happen is sometimes pain as well as bleeding can be there. So that is why this is one disadvantage of the lipase loop. Okay, so now coming to the next method, as anyhow lipase loop is outdated. Now there is nobody using the lipase loop. Now the second generation IUDs have derived, which is medicated IUDs. So here the methods, different types are copper IUDs and hormonal IUD. Now when it comes to copper IUD, you can understand the name itself, that is copper will be administered to the intrauterine devices. Why it is because again I have put the mode of action, will come to that. So there are different types of the devices that is available. You can see here copper 7, copper T20, then the newer devices copper T220C, and all those things are there. Now the numbers, usually again they ask this for the viva, what is the number along with the copper T indicating. So I have highlighted it here. The number in the along with the names is nothing but it is the surface area of the copper which is present on the device. Okay, so that is what is this copper T220C. So what is this 220? It's nothing but it refers to the surface area of the copper which is present on the device. Okay, so latest is multi-load device. Again, you can see here the picture of the multi-load device. Okay, now coming to what is the mode of action here. Metallic copper, you can go through the research articles in the internet, you will find the articles. The metallic copper is found to have a very strong anti-fertility effect. So that is why with the T-shaped device, when the copper is being administered, when it is inserted into the uterus, usually what happens is, you can see here, it releases the copper ions in the uterine cavity, which is actually very very toxic to the sperm. So what happens is, it kills the sperm, the sperms become non-motile, and further it doesn't have a capacity to go and meet the ovum as well as to fertilize the ovum. Other than that, also this copper enhances cellular response in the endometrium, and it also affects the enzymes in the uterus. So basically all these actions together act as a contraceptive method. So not only the biochemical composition of the cervical mucus is changing, but also because of the anti-fertility effect, what happens is, it will affect the sperm motility as well as sperm survival, and as in the sperms are also being killed. Okay, so this is what is basically happening in the copper intrauterine devices. Okay, so you can see here, after the insertion, this will be the image. Again, I hope it is understood. So we have finished in the second method, that is, we have covered barrier method, we have now covered the intrauterine device. We didn't finish the intrauterine device. So third generation intrauterine, I'm not going into advantages much, because again, pain and bleeding, it's like there are other complications. Please go through this, I'm not highlighting that part. We'll move to the third generation IUD, which is nothing but hormonal intrauterine device. Now the shape of the device is same when it comes to copper intrauterine device and hormonal IUDs, but the action is different, because the chemical that is administered is also different. Now in second generation it was copper administered, but in third generation it is hormones which is being introduced into this device, and that is why it is called as hormonal intrauterine device. Okay, now there are two types of hormonal intrauterine device. First one is progestasert, and second one is levonorgestrel. Okay, so here very slight difference is nothing but, here again it both are basically T-shaped device. So in progestasert, it will be filled with 38 milligram of progesterone hormone, and this hormone will be released slowly into the uterus with a rate of 65 microgram daily. Okay, so this progesterone hormone will be having direct effect on the uterine lining and mucus, cervical mucus, as well as the sperm. So once again, the basic action will be like, it affects the biochemical composition will be affected, and sperm motility and survival, all these things will be affected. So basically the mode of action is similar, but here what happens is, after few months, basically the hormone supply will be gradually depleted, and once this progesterone is completely depleted from the device, it has to be taken out, and replacement of the device is necessary. Okay, so this is what is happening in the hormonal intrauterine device. First type is progestasert, and second one is levonorgestrel. Now levonorgestrel is another intrauterine device, that is hormonal intrauterine device, which is trade name as LNG, that is Mirena is the brand name, trade name of the levonorgestrel hormonal IUD. Here again, the hormone that is used is levonorgestrel. Again, it is T-shaped IUD. So here 52 mg, if it is basically, before it was 65 38 milligram of progesterone was used, and 65 microgram was released daily. But in the case of levonorgestrel, it is 52 milligram of LNG is used, and only 20 microgram is released daily. So here efficacy of the levonorgestrel hormonal IUD is very high, that is, it can be effective up to 10 years. Okay, contraceptive effect can be longing up to 10 years. So again, mode of the action is very similar. You can see it works by thinning the lining of the uterus to prevent the pregnancy from the developing into full size, and then again mucous membrane will be thickened, so that it prevents the entry of the sperm. Okay, and sperm motility and survival will also be affected. So these are the common mode of action when it is coming to hormonal IUDs. Okay, so now coming to the advantages, again here also it is like once it is inserted again, it stays in the longest time period in the uterus, so there is no any motivation is required to remove and reinsert it continuously, because the efficacy is more. So other simple device, it is insertion is needing only a few minutes. All these things are the advantages of hormonal IUD. Now, along with the advantages, there are equally the contraindications also. So absolute as well as relative contraindications are there. Basically they don't ask this for UG students, but still, if at all, in case if it is asked, you can go with this. There are absolute contraindications as well as relative contraindications, which I'm not going into detail. Please refer the slide. Okay, now we'll go for the third method, that is hormonal contraceptive. So we have covered barrier method, we have covered intrauterine device. Now we are moving to the hormonal contraceptive. Now this is having different types, out of which combined pill is the most important category. Okay, so hormonal contraceptive is nothing but, as the name itself says, the contraceptive will be having some hormones introduced into that, and basically the hormones will be acting once it is introduced inside the body. So as in, you can see here, the first segment is oral pills, that is all the things are pills that we have to administer orally. And second one is depot formulations, that is, it can be either via injectable form, or it can be implant form, or it can be ring form. Okay, we'll come to that part now. Now, moving on to the first hormonal contraceptive, that is combined pill. Again, very, very important question, usually asked for Viva, as well as specimen will be kept for practical examination also. So here, the pills will be containing the synthetic estrogen as well as progesterone in the required quantities, and then the lady who wants to avoid the pregnancy will be consuming this tablet. Okay, so basic mode of action, how it is happening, is nothing but it prevents the release of the ovum by the ovary during ovulation. So ovulation itself is not happening here when it is coming to the hormonal contraceptive. So until the ovum is released, then there is no material to get fertilized. So the gonadotropin hormone and all those hormones will be acting here, and as a result, the ovum itself is not released. So that is how the contraceptive action is being happening here. Okay, so now what is the method of consumption of this pill is, there will be 21 pills which is to be consumed consecutive days, starting on the fifth day of the menstrual cycle by a woman. And after the 21 days, 21 days of consuming the tablet, a break of 7 days will be given, usually in which period menstruation will be occurring. Now, this is not menstruation exactly, but what it is you can see here, when the bleeding which is occurring, it is not like a normal menstruation, but what it is because of the like sudden stoppage of the hormonal tablets, the incompletely formed endometrium will be shedding. So that is what is causing the bleeding, and that is why it is called as withdrawal bleeding. That is withdrawal of the exogenous hormone that was being supplied so far, it's being suddenly stopped. That is why bleeding will be introduced, and that is why it is called as withdrawal bleeding. So it is not the menstruation that is like happening after the tablet is being stopped. It is exactly what withdrawal bleeding that is happening during that time. Okay, so this is also a viva question, usually you get what is exactly happening after the 21 days of the tablet consumption. So it's not menstruation, but it is a bleeding. Okay, so if at all the bleeding doesn't happen, again the doctors will be usually instructing the women to go for the second cycle, and after which the things will be continuing. Okay, so menstruation later, when the tablet is stopped, it will happen. So again, we are not going into that part detail. Okay, so this is regarding the hormonal contraceptive. I hope it's understood. Okay, so again, when it comes to mode of action, the lady has to go for the intake of the pill every day at a fixed time, preferably before the bedtime. So first course should be starting exactly on the fifth day of the menstrual period. Now, if at all the person forgets to take the pill, as soon as she remembers, she can go for the intake of the tablet, and next day's pill also she should be taking it on that particular day. So one tablet should not be missed. If at all she remembers it next day morning or afternoon, she can go for the the consumption of the tablet during that time, and that same day night, if she has to have a tablet, she has to have the same tablet that day again. Okay, so this is what is the mode of administration. Now there are different types for this, mala D and mala N, which is popularly available in the Indian market, which is being associated with the family welfare, that is Ministry of Health and Family Welfare, which is by the government of India. So again, mala D and mala N both are available in the market. So one is provided by the government for free of cost, and one is available in the market for 3 rupees. Okay, this is what is regarding the combined pills. Okay, so now moving on to the second one, progesterone only pills. I think these are not that very important for you guys. So I'm not going into highlights of all these things. So we have different types, that is progesterone only pills, wherein it contains only the hormone progesterone, which is given in small quantity. And then here what happens, mode of action is, again, it makes the cervical mucus very thick as well as scanty, and it will inhibit the sperm penetration. So that is how usually it happens. I mean, mode of action is happening. And again, apart from this, tubal motility will also be affected. So what happens is, it will delay the transport of the sperm to the ovum. Okay, so this is regarding progesterone only pill. Now third is post-coital pill or post-coital contraception. So one post-coital contraception that is already available is intrauterine device. Now when it comes to pill, we can go for the emergency pills that is available. So in India, basically 0.75 mg tablet is approved for the emergency contraception. That is tablet of it should be consumed within the 72 hours of unprotected intercourse, and the second tablet with the 12 hours of the dose. So this is how the method of the administration is being mentioned. Okay, so it's available in the market in different names. So this is regarding the post-coital contraception. Now fourth one is male pills. Again, it's not a very popular one. So basically, mode of action is, it will prevent the spermatogenesis, or it will prevent the sperm storage as well as maturing the sperms, or it prevents the sperm transportation, or it again prevents the constituents of the seminal fluid. So that is how male pills are acting. Again, not that very important for you guys, so that's why I'm not going into detail. And last one in this is once in a month pill or once a month pill. So here also the quinestrol is being used, that is long acting synthetic estrogen is being given here. So again, the pill will be swallowed, and it is having a gelatin substances which is coating on the pill, so that it doesn't get dissolved in the stomach acid very quickly. So it stays in the stomach for longer time period, and each time it will be releasing the hormones, and again the pregnancy will be prevented. So this is what is once a month pill. So because of the complications and disadvantages, again, this is not very popularly used in the market. So but still we have the example, so that's why it's being put. Okay, so this is regarding the pills, which is combined pills, which are available in the hormonal method. But we also have told that we have depot formulations which are in the different other forms. So first one is injectable contraceptive. Now injectable contraceptive is DMPA, that is depot metroxyprogesterone acetate, and again net N. These are the two things that is available. So as in, you can understand, when it's named as injectable, it's nothing but it is being injected into the body. So as a result, I mean, it is being inserted into the bloodstream directly, so it will be releasing the hormone. So as a result, again, the women will be women will be preventing the shedding of the ovary every month. So as a result, the women do not conceive. Okay, so that is what is the mode of action that is happening in the injectable form. Now next is subdermal implants. I'm going a little bit fast here, because again, for UG students, it's not very commonly asked, but still, if at all it's asked, I don't want you people to miss it though, so that's why including here. Next is subdermal implant. So again, it's the implant which is available like rod like structure, so that will be implanted beneath the skin or forearm or upper arm. Again, efficacy of 5 years is there. It will release the hormones. Okay, you can see here 35 milligram of levonorgestrel is introduced into the implants. Again, basically the hormone will be introduced into the body, and as a result, again, the ovum will not be released, and all the procedures continue. So that is what is subdermal implants. And last one is vaginal ring. Again, these are also will be introduced with some hormones, and as a result, once it's being introduced inside the body, again it will be releasing the hormones, and similar actions will be taking. It will be just releasing the, I mean, stopping the release of the ovum every month. As a result, the women doesn't conceive. Okay, so this is coming under the hormonal contraceptive. We have oral pills as well as we have depot formulations. Okay, now coming to the next method, that is post conceptional contraception methods. That is, once the lady is conceived, or so called she is in a doubt of conceived, or what should we do, or what are the methods that can be administered. Those are the methods which being mentioned over here. That is, we have menstrual regulation, we have menstrual induction, as well as we have oral abortifacient. Now coming to the menstrual regulation, it is nothing but it's a surgical, small surgical procedure in which cervix will be usually dilated and then the tissue will be removed from the uterus. Okay, so that is simple meaning. It is nothing but aspiration of the uterine contents before a 6 to 14 days of a missed period. I mean, after a 6 to 14 days of a missed period. Okay, so basically aftercare is not necessary. The lady can go immediately after, like after a few hours of observation, the lady can go leave the hospital. It's just the menstruation is regulated by dilating the cervix and removing the contents, that is aspiration of the uterine contents. Okay, so this is coming under menstrual regulation. Next is menstrual induction. Here, again, a prostaglandin F2 solution will be introduced into the uterus, and as a result, the cycles introduced after 7 minutes of the contraction. Okay, so this is usually happening, and after this process continues for around 3 to 4 hours, and by 3 to 4 hours, the bleeding will be introduced. That is, whatever are the products of consumption, it will be shedding out, and the bleeding will be as in like normal menstruation. That is 7 days it will be continuing. Now here, as well as next method, that is oral abortifacient. This is the third method. Now all these three methods, there is one thing that you should be careful, or one thing the couple has to be careful is nothing but, even after the things like removal is happened, removal of conception has happened, a follow-up visit is mandatory after a few weeks in order to make sure that there is no remnant of the conception present inside the uterus. Because if at all, if there is available, a small part is still available in the body, that is inside the uterus, there are chances that the women can end up in toxic shock actually. So that is why in all these methods, a follow-up visit would be ideal to check whether there are any products of the consumption remaining in the uterus. Okay, so third thing is oral abortifacient. We have like two tablets which is being given, that is mifepristone as well as misoprostol. So mifepristone is given 200 mg orally in the first day, that is, you can see here the big tablet, and misoprostol, which is the four different tablets that can be given, four tablets, that is vaginally, or it can be given orally, which is in a quantity of 800 microgram. Okay, so this is regarding the oral abortifacient. Usually this is very successful in terminating 9 weeks pregnancy. Up to the 9 weeks pregnancy also it is very successful, but sometimes the matters can be different. Body responds in different way. That is why in all the above three methods, follow up is mandatorily to be done. Okay, so this is regarding the uh, uh, post conceptional methods. Now coming to the permanent method, we have already seen, that is tubectomy as well as vasectomy. We have these two things. Okay, so tubectomy and vasectomy, I think I need not go in detail here. Vasectomy is nothing but it is vas differentials cut or tied or sealed, and then it prevents the sperm entering into the urethra, so fertilization is being prevented. And tubectomy is nothing but it is the process that is administered in the women, wherein fallopian tubules are cut and blocked, and as a result, egg is not being released by the ovary. Okay, so this is regarding the permanent method. Now there is one more method in the initial slide that we have seen, that is miscellaneous, or we can either consider it as a natural method of contraception. So it is coming under the temporary method itself. It's not coming under the permanent, but as it's a natural method or miscellaneous, I've put it separate from now. That is First one is coitus interruptus, which is nothing but withdrawal of the penis from vagina before the ejaculation. This is first thing. Second one is calendar method, again commonly asked in the viva or even in the question paper also. What is calendar method or what is safe period? So in a cycle, you know that a woman will be having fertile period as well as safe period. So the couple can go for, if the couple wants to conceive, then they can go for the coitus or intercourse during the fertile period, and other period, if they like if they do not want the child, they should be avoiding the intercourse during the fertile period. So basically it's a calendar method, but failure rate is very high because of the hormones production, and calendar can be different in women according to her lifestyle or physical exercise or stress, or all these things have a role in the hormone regulation. So that is why not a very common method that is administered, highly successful also, it's not at all successful. Failure rate is very high. Okay, so this is regarding the calendar method, and last one is abstinence of sex. Okay, so with this we are coming to the end of family planning and family planning method. So basically, either the family planning whole can be asked for 10-mark question with the methods of the family planning. So commonly asked questions is what I'm saying, or intrauterine device can be asked for 5 marks, or any other methods, that is which is barrier method or any other methods can be asked for 5 marks. Now 3-mark question, usually they ask male and female condoms or safe period or calendar method. All these methods are asked for 3 marks question. So if at all it is asked, you need to be if intrauterine device is asked, you need to be mentioning what is exactly intrauterine device and what all are the generations, that is medicated as well as non-medicated, first, second, third generations are there. And you can go for the figure, diagrammatic presentation would be ideal to get a good marks. So that is what is coming under intrauterine. And even if it is asked calendar method also, please try to draw the calendar which is displayed over here. You will get it in the internet as well as in the textbook also, park textbook also, it's available. Better would be going for the calendar drawing as well as marking it what is the safe and safe period as well as infertile period. That would be good for you to fetch the marks directly, because once the diagram is there, the examiners will also be knowing that you know the concept. Okay, so this is coming under family planning. I hope it's understood, I hope it's clear also. Now we'll move on to the next segment, which is given again, mother and child healthcare. So again, this is also a very very important topic. So basically, from family planning and maternal child healthcare, around 25 to 30 marks question will be usually asked actually. So if this can be changed according to different years, but every single year minimum of 20 marks of question will be available from both these topics. So please make sure that you are thorough in these two topics. Now again, we'll move on to the maternal and child healthcare. Okay, so coming to the basic introductory part, you know, maternal health is very important here. Not only mother's health is important, but mother is bearing a child inside, a baby inside. That is why maternal and child health is very important in order to restore, promote, prevent, cure the health of the both mother as well as the child. Okay, so this is coming under the maternal and child health, and this introductory part I'm not going into the detail. Now there are objectives of mch, which is again, first prime most objective is nothing but reduction of maternal, perinatal or infant or childhood mortality or any kind of morbidity, both the mother as well as both the child. And then the reproductive health of the mother is very important. After each delivery, the mother will be going through a physical trauma as well as even mental stress. So restoring her health is very very important. That is why reproductive health promotion, again one of the basic objective. Third one is promotion of physical and psychological development of the child and adolescent. Once the child is coming into the world, again his or her mental health as well as physical health also is a very very important thing. So that is why again, one of the basic objective is this. Now so these are the basic objectives coming with the MCH. Now we have three different segments for this mother and child health care. So first one is antenatal care, second one is intranatal care, and third one is postnatal care. So I hope you might be already having an idea what are the three different titles coming as. So first one is antenatal care. Okay, so antenatal care is nothing but it is the care of the women during the pregnancy. Okay, that is since the mother starts, that is immediately the mother is conceived, since then till the pregnancy, that is till the delivery, throughout this pregnancy time period, what all are the care to be given to the mother, that is what is called as antenatal care. Okay, so basically what it is including is the components, that is identifying the risk, that is if there is any risk for the mother to deliver, or if there is any complications that's being happening, then we have to identify the complications and help what all are the mother can do in order to rectify those things. Second one is prevention and management of these pregnancy related any complications or diseases, and third one is health education and health promotion. So these are the basic components that is coming under the antenatal care. Okay, now here we have again different set of objectives. So again, I'm not going into this part detail. You can just go through the slide and understand. One thing is to detect any high risk. If there is any high risk is involved in the delivery, we can identify it earlier and then go for according to the remedial measures. Or if there is any complications which is being identified in very early stage, we can go to rectify these complications. And as I said already, mother will be having an anxiety or mental stress because she is going through a tough time during this 9 months. So in order to remove those anxiety associated with the delivery, then again maternal and mortality as well as morbidity we have told in the first slide itself. Next is to teach the mother what is regarding childcare. See, after the delivery still there are time left for the mother, for the child, because child has to develop, child has to grow, child's nutrition is very important, child's health is very important. So if the mother is totally unaware of these things, it's very difficult for the child in the future. So that is why we need to educate the mother regarding what all other things to be done for the child care or nutrition or even for the personal hygiene and all those components. And last one is to sensitize the mother for the need of family planning, including the medical termination of the pregnancy. So family planning, as we have already seen, family planning, if the mother is delivered now, she should be knowing when she has to have a next child, which is without affecting her current health as well as her child's health. So according to this, we have to sensitize the mother. Okay, so these are the prime most objectives which is coming under antenatal care. Okay, now coming under what all are the components that is coming under the antenatal care, it is including antenatal visit, it includes prenatal advices to be given to the mother, it includes specific health protection, it helps it includes mental preparation as well as it go for the family planning. Now I'm not going again very detail in all those things. So antenatal visits, as it might be already knowing, the first visit within it should be within the 12 weeks, preferably as soon as once the woman is suspecting pregnancy, in immediately to register the pregnancy, first antenatal checkup has to be done within the 12 weeks of the pregnancy. Second visit has to be between 14 and 26 weeks, and third visit has to be between 28 and 34 weeks, and fourth has to be between 36 and the term is attaining. Okay, so ideally the mother should be attending antenatal clinic for the visit once in a month during first 7 months. That is first 7 month of the pregnancy, the woman has to be visiting the clinic every once in 7 months, that is in the 7 till 7 month. Then after seventh month she should go for the antenatal visit twice a month. Okay, that is eighth monthly they have to be going for 2 times, and thereafter it has to be once a week till the delivery is being planned. Okay, so this is regarding the antenatal visit. Now coming to remaining things that is coming under the antenatal care. So we have told here first one is antenatal visit. So we have covered antenatal visits. Second is antenatal checkups, which is coming here. So again, I think I need not go here in detail. We have some elements like history taking. Okay, so in history taking, we should be going for recording all the history of the mother. That is, what is first day of last menstrual period, what is EDD, what is the previous conditions, was there any complications in the previous delivery, whether it is the first child, all those things they have to be going for recording. And if there is any associated symptoms like bleeding or vaginal discharge or breathlessness or anything, any complications are there, if there is any systemic illness present or was there any history of systemic illness present before, if there is any family history of hypertension, diabetes, TB or thalassemia or any other complications, all of these has to be recorded. Very importantly, drug allergy is one of the important thing. All these things has to be recorded. This is basically involved in the history taking. Now next is physical examination. It's just again pulse examination, respiratory rate examination, as well as blood pressure. All these things has to be recorded. Along with this, other than these three components, it also includes pallor. It has to be including edema, whether edema is present. Again, it has to be including weight gain in the pregnancy. Okay, so and along with that, breast examination. These are the elements that is coming under the physical exam, sorry, history taking. Okay, so I'll repeat once again. Antenatal checkup, we have first thing, that is history taking. So after the basic history taking, we have to go for the physical examination, that is pulse, respiratory rate, blood pressure, pallor, edema, weight gain in the pregnancy, as well as breast examination. All these things has to be examined in the physical examination. Now next is abdominal examination. So I think again I have put up the picture here so that you will understand. So fundal height examination, or these things has to be recorded so that they can understand when is the gestational age, what is the development of the baby. These things can be understood. Next is fetal heart sound. It can be measured via fetoscope. Okay, whether the heart rate and all those things are correct, whether fetal heart rate is fine. Then fetal movements can be felt. Again, this has to be examined between 18 to 22nd week. Fetal parts has to be examined. And then if there is any multiple pregnancy, that can be observed. If there is anything or if there is any complications, again that has to be taken care of. Then fetal light presentation has to be examined, and inspection of abdominal scars. So all these things are coming under the abdominal examination. So we have seen in antenatal checkup, first one is history taking, second one is physical examination, and third one is abdominal examination. So I've put up pictures here so that you can understand when it is being seen. So next is assessment of gestational age. Again, I'm not going into that part in detail. Whenever the development of the baby is understood, so that gestational age can also be calculated. When can be the mother be prepared for the delivery? These things can be calculated. And next is laboratory investigation. If there is any test which is required, that is like rapid malaria, or if there is any albumin sugar test, if there is anything required, or blood grouping, RS factor, then RPR, HIV testing, all those things can be done in order to see that whether there is any associated complications or underlying causes or problems. Okay, so this is coming under the laboratory investigation, and these are the things coming under the antenatal basic checkups. So we have discussed regarding the essential components of the antenatal checkup. Whatever I have mentioned, all these things previous slide, I'm not going into that part now. Second part which is required in the antenatal care is prenatal advice. So prenatal advice must include about diet. Like if you refer park, you will understand there is a detailed explanation regarding what all has the lady to be including, that is iron rich food has to be taken. All those things are there, I'm not going into that part detail. Then personal hygiene measures are very important. What all are the drugs that is being consumed by the mother along with other drugs is also important. Then radiation, she should not be exposed to any sort of radiations. Again, it's not good for the baby as well. Then if there is any warning signs to be taken care of, that has to be examined, and accordingly they have to be given ideas what all the mother should be taken care of, and as well as child care. So these are the advices that the mother has to be given during the antenatal care. And next is specifically what all are the health promotions or protection measures that is to be taken care. Again, it's regarding anemia or any toxemias of pregnancy, tetanus, syphilis, all these things has to be taken care. Again, I'm not reading these things in detail because it's all coming under your gynec part, as well as your pediatric part. So I'm not going into these parts detail because it will be very lengthy. That's why, or else we should have discussed. But again, some other time if we get, we'll discuss. So next is mental preparation. Again, I've been starting since starting. I'm telling mother is going through a mental stress time period. She will be already having anxiety of regarding the delivery, that is regarding a normal delivery or even if it's a c-section also. So it is doctor's duty to give the advice regarding the delivery and to prepare the mother regarding the delivery. So that is happening under mental preparation. And last one is family planning. So after each delivery or through the antenatal care, the mother has to be given ideas regarding when it would be safe the mother to go for a next conceiving or next pregnancy. All these things has to be given. Okay, so what all are the methods of family planning that can a lady can administer after her first delivery or after her second delivery? Regarding all these things, advice or counseling has to be given. Okay, so basically these are the components that is coming under the antenatal care. Now we are moving on to the intranatal care. Now here it is nothing but it is the care which is given to the mother and baby at the time of the delivery. So during those few hours of delivery, what is the care that is being given to the mother and child? That is being called as intranatal care. So here basically it is emphasized on the cleanliness, that is sepsis has to be avoided. If there is any septic conditions or septicemia involved because of the instruments or equipments or anything used, then that is not good for the mother as well as for the baby. So here in the intranatal care, the complete emphasis is on the cleanliness. So the doctor who is handling, the nurses who is handling, the other health workers who is handling the OT and all those things, they have to be given advice regarding the cleanliness, the surface of the delivery, what all are the cord care that has to be taken care after the delivery, then cord stump, what all to be done, or how it should be like process has to be done, and how the birth canal has to be cleaned. All these things will be should be taken care during the intranatal care. Okay, so hospitals basically should be having a very equipped delivery kit along with the health professionals also. So sterile gloves and drapes has to be used, and towels as well as cleaning materials and antiseptic solutions, all these things has to be made available. Okay, so basic objectives or aims of this intranatal care is, again as I said, asepsis, asepticemia, or to avoid the septicemia is what is the basic care, basic aim of the intranatal care. And with minimum injury, that is a delivery with minimum injury to the mother as well as infant. And to handle the complications, if at all there is any complications, whether the hospital or the doctors are being prepared, whether that is there, this has to be taken care of. And if at all, once the baby is being delivered, once the baby is coming out of the womb, what is the care of the baby, or what is the care to be given to the baby, that is resuscitation, care of the cord, all these things has to be taken care of. Okay, so these are the basic aims of intranatal care. Now this also includes domiciliary care and domiciliary midwifery service. It's nothing but mothers, like if the mother is not having any complicated obstetric history, they can go for the own houses also. Not in good practice these days, but these days nobody opt for it. But sometimes domiciliary care, what is domiciliary care, you will get a viva question. That is why I've just put it in the slide here. So that is what is called as domiciliary midwifery service. That is, if the mother with a normal obstetric history is being present, she can go for the like house delivery itself. That is what is called as domiciliary care. Okay, so coming to the last segment, that is postnatal care. So here, after the delivery is done, what is the care which is to be given for the mother as well as child? That is what is coming under postnatal care. So again, as in mother's health is to be upgraded, the care of the newborn is very important. These two elements are combined here in postnatal care. Again, we have care of the mother as well as care of the child also. So Care of the mother, again, I think it will be repetitive if I again and again tell the same thing. If there is any complications, we should go for, if there is any complications that has to be tackled, then mother's health has to be as soon as restored. Then the breastfeeding, that is immediately whether the breast milk is there, adequate breast milk is there to give to the child. These things are very important. And to give whatever family planning services, if at all tubectomy, vasectomy, sorry, not vasectomy, tubectomy is required, the mother can go for it, or if it's spacing which is required, the mother can go for that. All these things has to be taken care. Also, in postpartum period, there are sometimes complications involved like puerperal sepsis, thrombophlebitis, or secondary hemorrhage. So if at all there are any of these complications arising, then measures has to be taken to avoid these complications as well. Okay, so this is regarding the postnatal care. Now, first part is restoration of the mother, as I said already. So, postnatal examinations has to be done, anemia checking has to be done, nutrition matter has to be counseled to the mother, and postnatal exercises to remove the stress of the mother's body after a delivery. These things has to be advised. Then physiological advices has to be given, that is not physiological, sorry, psychological. Again, I'm not going into that part again detail. I've told it enough time, so I hope you understand it. And then social, that is after having a baby, again, like to give a best possible child care, all those things has to be advised to the mother. Okay, it's like we have to give counseling regarding like how to grow up a child with her husband. These things has to be given, and adequacy of the breastfeeding has to be advised. So these are the things coming under postnatal care regarding mother. Now we have one more person here to take care, that is care of the child. Okay, so care of the child, I've put it only the basics because I'm very pretty sure that you will be already having Kaumara Britya classes also in this, or you might have already got the Kaumara Britya classes. So here in the neonatal care, we have two components, that is early neonatal care and late neonatal care. So these two things has to be discussed in the neonatal care. Now, please note, in I think 2 years back in the Swasthavrita question paper, in single question paper, there was two questions that had come regarding, one is neonatal care for 5 marks, second was Apgar scoring for 5 marks. So please make sure that neonatal care is also very important in the community medicine paper. Please do not skip this part thinking that it is Kaumara Britya part. But I haven't gone those things. I mean, I am not explaining those in details because I am sure that you will be having Kaumara Britya classes. You can add on the same details over here because it's the same which is mentioned in the Park textbook as well as here. But little concise form when it is coming to the preventive and social medicine. Okay, so neonatal care has to be explained. So in immediate care, wherein clearing the airway, Apgar scoring, cutting of care of the cord, care of the eyes, care of the skin, body temperature maintains, and regarding the breastfeeding. All these things comes under early neonatal care, along with that neonatal examination. So again, neonatal examination, head circumference, length of the baby, weight of the baby, all these things are coming under this category. So I'm not going into this part detail because it will be very lengthy. So that's why I've cut short till here the details. I hope it will be it would be good if you refer the Kaumara Britya text or even Park textbook for the further details. So I think with this I'll wind up the session. So from mother and child healthcare, basically antenatal care can be a 10-mark question. Usually intranatal care and postnatal care is not a very common question that is being asked. But from the postnatal care, again, neonatal care or Apgar scoring or what all are the neonatal examinations, these can be asked for 5 marks. What I've seen is 5 marks. For 5 marks, they have asked these questions. So please note that do not skip this part thinking that it is a Kaumara Britya part. Please be making sure that you read and go for the community medicine paper as well. Okay, so MCH alone can be asked for 10 marks, or antenatal care alone can be asked for 10 marks. So you see the question, if at all antenatal care is asked also, please define what is mother and child health care and then go for the antenatal care. Do not directly start with the antenatal care, because it's a part of maternal and child health care. Please mention what is mother and child health care, and it is having three segments, that is intra and postnatal care, and then go for the explanation of antenatal care. That's how you should be answering the question. Okay, so with this, I think the class was helpful. Whatever I could put up in the slide for not making it very elaborative but not making it too short, I have put it up here. If there is any further inquiries, you can please ask me if there is anything. So I hope it would be, I mean, this is helpful. So yeah, thank you so much.
Ma'am, for an insightful session. It was very informative session as well. You have told so many information which has to be written in the paper, so has to gain the marks, and you have also mentioned the points which have to be written when question is asked. We are very happy that you have accepted our invitation, and in your busy schedule you took some time for this session. Thank you so much, ma'am. It was a very informative session. Any queries regarding this series will be forwarded to you, ma'am. You can answer the questions, so the answer will be forwarded to them as well. And whatever the session you have took now, we'll be uploading this to the YouTube channel, where the maximum students can be able to see them and can gain the knowledge, ma'am. We are very happy that you accepted our invitation. Thank you so much, ma'am.
Yeah, thank you so much for giving me an opportunity also to work with Panchajanya. So I'm happy that you started this initiative. So please continue, so that everybody, every student across the, your university can be accessing it, so that it would be helpful for them.
Thank you so much, ma'am.
Yeah, thank you.